next, our founder, Alexander Nicholas, interviews Dr. Alexander Mauskop. Dr. Mauskop is the founder and director of the New York Headache Center. He's a professor of clinical neurology at SUNY Downstate Health Sciences University. He writes a popular blog, newyorkheadache.com/blog. His latest book, The End of Migraines, 150 Ways to Stop Your Pain, has been one of the most popular books on migraines on Amazon.com.
What is the difference between a headache and a migraine?
Well, migraine involves a headache as well, but migraine is more than just a headache. Headache tends to be milder. People call the regular headaches, and we call them officially tension type headaches, because very often it's a result of tension, stress, and it's not severe. And usually people take over-the-counter medications and they're fine. Migraine is usually much more severe. And the definition of migraine includes several other features: light sensitivity, noise sensitivity, throbbing pain, often one-sided pain, while tension headache usually on both sides. So there are more features. And some people don't have severe pain, but severe nausea and vomiting. So migraine tends to be much more disabling than the regular headache. That's the main difference. But there is a continuum. Some people have a tension headache and sometimes it becomes a migraine. So they're not mutually exclusive either.
Okay, so then with a headache, for instance, is some of the symptoms of a migraine, like a headache can happen with some of the symptoms of a migraine. So how do you determine whether something's a migraine or a migraine or a headache?
Well, those are the features. If you have a little throbbing and feel a little nauseous, that becomes a migraine.
Okay.
If mild, and many people actually have migraines and don't know that these are migraines.
Right.
We have research showing that 50% of people never go to a doctor because they take over-the-counter medicine and they don't realize it's a mild migraine. So the important thing is to get rid of it.
Right, of course. Well, I don't think I knew until a year and a half ago that I was experiencing migraines myself. So I'm an example of that. What are the underlying causes of a migraine, and can disabilities and medical conditions contribute to a migraine?
Yeah, so that's a very typical question people ask. I want to find the cause, eliminate it, and get cured. Right. Unfortunately, a big part of a migraine is a genetic predisposition, which you cannot cure. You're born with lower threshold for migraines. Just like some people will have back pain or stomach aches when they're under stress, for other people, it's a migraine. So migraine is a combination of genetic predisposition with external factors such as stress, lack of sleep, certain foods, alcohol, dehydration, weather changes, menstrual cycle, and many other triggers. And sometimes it's very hard to figure out what the triggers are because there are many that could be at play. And some people will say, when I'm distressed, I don't get a headache. But if I am in distress and have a glass of wine, then I'll get a migraine. So it's a combination of things. Okay.
And so when we talk about quality of life, how does, like in severe cases or moderate, that work or social outings or so forth affected?
Well, so people are very surprised to hear that migraine is the second most disabling condition affecting the human race. After back pain is like 70% of people at least once in their lifetime have back pain. Migraine is second most disabling, but unfortunately, it doesn't get respect. Like Rodney Dangerfield, no respect because you don't die from migraine.
Right.
Migraine disables a lot of people, just like you mentioned. We have people who are unable to work on long-term disability. Many people go on short-term disability. But even those people who seemingly have it all together, working, having family, and busy life, when you ask them, and we have a specific measures, quality of life measures, that tells us their quality of life is horrible because they miss a lot of social activities. They cannot enjoy life. And migraine, even though it's not deadly, can be extremely disabling.
So now getting into treatments, there's both alternative treatments as well as prescription drugs. for alternative treatments, what is out there to help?
Yeah, so that's a good question because most people don't want to take drugs. They say,
Right.
I don't take medicine. So luckily, you don't have to. For most people, there are several we call lifestyle changes that can be very helpful, but also non-drug therapy. So lifestyle changes, which are difficult to do for a busy person, especially living in New York City, is getting enough sleep, number one, because I tell people if you don't get enough sleep, your brain becomes irritable and you're more likely to get a migraine. Number two, regular exercise. Has been proven in many studies. It's not just because it's good for you. It actually prevents migraines. And surprisingly, recent research indicates that weight training is even better than cardio for migraine prevention. So that's number two after sleep.
Why do you think that is, weight training better than cardio?
Yeah, we think that there is more of a substance release called BDNF, brain-derived neurotrophic factor in muscles that nourishes the brain. So that's why we think weight training in general is good for everyone. So definitely exercise, those two things, sleep, exercise. Next on the list, diet, obviously. Too much sugar can give you headaches, preservatives, smoked, pickled, cured foods. So healthy, low carb diet, because carbs often give people a spike, then they crash and they get a migraine. Next, after that, another excellent way to manage stress and prevent migraines, also proven, and that's meditation. So mindfulness and meditation, that's been definitely proven to actually expand your brain, more connections between the nerve cells. Your brain looks thicker on the MRI scan if you meditate. So those are four top things. And then we have supplements. Close to half of people with migraines are deficient in magnesium.
Yeah. So why is that?
Good question. Everyone wants to know. So again, a combination of factors. There is a genetic factor because we have actually 3 generations of one family suffering from low magnesium levels. And the second contributing factor, just like with the cause of migraines, is that if you don't eat a healthy diet, it's poor in magnesium. Dark leafy vegetables, whole grains have magnesium. Also, people who have migraines are more likely to get stomach issues like irritable bowel syndrome or colitis, and that impairs absorption of magnesium. Alcohol is a depleter of magnesium, so there are many reasons. So magnesium, we typically check the blood level, but I think people can just take a supplement and see if it helps. The worst thing that can happen from magnesium is loose bowel movements. If you take it in an empty stomach, it can make you go. And that brings up the question of which kind of magnesium to take. So chelated forms of magnesium, like magnesium glycinate, gluconate, aspartate, taurate, those are better absorbed forms of magnesium, and the usual dose is about 400 milligrams a day. So that's the top supplement. The second most common deficiency in people with migraines is coenzyme Q10. CoQ10, 1/3 of people with migraines are deficient, and you can take 100 to 300 milligrams daily, and that actually works for some people very well. So these are the top line non-drug approaches that can help really a large number of migraine sufferers.
And do you find now more and more that some of these approaches are just as effective as prescription drugs or almost as effective depending upon one's migraines?
They can be more effective than drugs. For example, if you're deficient in magnesium, drugs don't work as well as magnesium supplementation. And more importantly, not more importantly, but as importantly, they're safer. So yes, I've seen people who started exercising and migraines went away, better than the drug.
So interesting. So over the course of treatments and quote unquote maybe finding a cure, and all the research that you and other doctors are doing, where do you see the research and treatment at in 10 years?
I think we are living through very exciting times in medicine in general. And in about 10 years, there's a lot of hype about AI, and it may not be deserved hype, but in medicine, it is very much so, because we are actually expecting major breakthroughs in the next 5 years even. But in 10 years, we might have more individualized approach. Now we try this medicine, try the other medicine, try this treatment, that treatment. it's a purely trial and error process. But I think in 10 years, we will be able to do a genetic test, a blood test, and we'll know which treatment is the right one for you. So it will be much, much more efficient, effective, and less expensive.
Oh, right, of course. Lastly, what advice would you give to new migraine sufferers?
Well, the best customer is a very educated customer. So my first advice would be read up on the condition and see a physician if you need quick relief, that is, you need prescription medicine. And by the way, I just want to mention one prescription medicine that is not prescription in Europe and many other countries, and that's a class called triptans, sumatriptan, Imitrex. It's safer than Advil or Excedrin. And people often think prescription must be more dangerous. In fact, that's a safe, effective treatment. And that's the reason to see a physician while you're working on your lifestyle and meditation and other things. You may want to get some immediate relief from this medicine. For some people, Advil Aleve is sufficient, but for some people, sumatriptan or one of the newer drugs is a lifesaver.
And it's stronger than an Advil migraine or a
It
Tylenol.
is different. It's a different mechanism. So for some people, Advil is great, and they don't need anything else. But if not, this works through a different mechanism in the brains. Because some people, this is the magic.
Well, thank you so much. This was lovely.